Welcome to today's webinar with Whiteford, Taylor, and Preston. Our topic is Top Legal Considerations for Returning to In-Person Church Gatherings. Our speakers today are Erika E, the church attorney and partner at Whiteford, and Scott Graham, Director of Emergency Preparedness at Holy Cross Health and Vice President of Maryland Region 5 Emergency Preparedness Coalition. Erika, please take it away.
Thank you so much, Dan. I'm excited to share this important information with our church clients and churches everywhere as we consider what life might look like on the re-entry side of things. So when it became apparent that large crowds could no longer gather back in March of this year because of health and safety concerns, in-person church services ended rather abruptly. While the COVID-19 crisis and global pandemic, many would say it seems far from over, still we're at the place now where these discussions of how we reopen as a nation, as a community, are underway. So it's important that churches consider the next steps, and I know that I've been a part of any number of webinars with large church planting organizations, denominations, and other churches discussing this topic. And of course, the inherently communal nature of a church fellowship lends itself to being social and in close contact. I mean, church leaders are always looking for ways to bring people close together. So what do church leaders need to consider to avoid catastrophe when inviting the community back to church? So in this webinar, I'm looking to provide the top legal considerations, recognizing that there are more questions than answers right now, and that this is an unprecedented time. I'm also interviewing a special guest, Scott Graham, who, as you've heard, is the Director of Emergency Preparedness at Holy Cross Health and the Vice President of the Maryland Region 5 Emergency Preparedness Coalition. So I appreciate Scott for being a part of this webinar, and we'll get to hear from him and very shortly. You'll find what he has to share to be of great value. So first, our firm has a large footprint. There's 175 attorneys, and we're stretched across the Mid-Atlantic. So our offices cover lots of geographic areas, and which is also the same with many of the church clients that we serve. So these issues, as we've seen with the solution of returning to in-person gathering, what it looks like to reopen, I mean, the questions are far and wide and vary based on the local experience. Me as the church attorney, I've represented churches for well over 20 years, and it's what I do all day, every day. I'm grateful to be able to lead our churches and faith-based organizations group here at Whiteford, and serve in various capacities, and grateful to speak at organizations about how churches can remain in compliance, especially in these trying times. So let's dive into the chief liability considerations. What are they? Well, what are the chief liability considerations, the top concerns about returning to in-person gatherings? At the end of the day, it's about the safety of the people, right? It's how churches can do their reasonable best to ensure that they're creating a safe environment so that when people return, we can do our best to avoid the possibility of a claim, in other words, the filing of some piece of litigation that charges the church for a person contracting COVID-19. I mean, at the end of the day, that's the top liability that we want to avoid. We want to avoid a kid getting sick, elderly person getting sick or anyone falling ill because they came to a church service. We want to ensure that the house of worship is a place of safety. So that's really the top legal consideration. Now, the question is often asked is, can this possible liability, that is the liability of a claim being filed against the church, can maybe, if something like that were to happen, could it be offset by insurance? And frankly, that's been a huge question, and many have found that because of the various changes, that we could not have possibly have foreseen this novel virus, that it may not be covered under insurance. But I would encourage you to reach out to your carrier and raise this question specifically. I would encourage you to pull your policy, specifically look at your declaration pages, which is generally the first 1 or 2 or 3 pages of your policy, and see what's covered. Reach out to your broker, because having coverage under this new era has been one of the most important considerations for businesses, nonprofits, churches alike. So do check with your carrier. But I will tell you, in my experience, many carriers have taken the position that insurance does not cover a claim such as the claim of being exposed to the coronavirus at church. So that really heightens the need for churches to be especially cautious, because insurance might not mitigate this risk. Now, when we consider the rollout of individuals returning to the church facility, it's most likely that you're going to turn first to your employees, your staff, your key leaders, right? Because first of all, these are individuals who probably are inherently necessary to ensure that the work of the church is moving forward as fluidly as possible. These are the individuals who might be a part of your praise and worship, your worship team, your CFO, your teaching staff, etc. These might be the people who are doing community ministry and all those things that you hope to continue even while we are in quarantine or self-isolation, or however we want to define it. So for employees, it's a little different, because there are certain duties of one's employment that an employer can continue to expect. So, for example, an employer can continue to expect an employee to do his or her job to the best of his or her ability, even in the current circumstances. And so once the church has reasonably made the facility clean and disinfected in a way that federal and state guidelines would indicate, once the facility can, the church can reasonably ensure that individuals social distance. Maybe you want to require that the personal protection equipment, the PPE that we hear so often on the news, is readily available and perhaps mandated as a part of the work environment, then you might be more comfortable inviting your employees back. And there may be some additional motivations around that. For example, the remote work environment sometimes is not as ideal for data security. So one of the key components of data that the church should properly safeguard is giving records, credit card or debit card numbers, anything around the receipt of, if you still take checks, etc. You want to make sure that you really maintain proper data security. And so having workers return could help facilitate that. Now, there may be people that you don't want to readily have come to the building, like delivery services. You may just receive deliveries on the outside of the building, maybe have a certain drop zone, a designated drop zone. And for cleaning staff or any other non-employee individuals like independent contractors, you may want to make sure that you are very clear about the requirements that they must meet in order to come into the facility. Now, the bigger question probably regards how we manage the reentry of the membership of the congregation. And I believe that by creating a secure environment plus having essential good communication, that's really going to be the ticket for individuals to feel more comfortable coming back to the building. This is not a circumstance where if you build it, they will come, that bygone saying. The truth is, many places may open, and we're finding this in the retail market, right? Stores opening, malls opening, but people are not coming because of, health and safety considerations. So it's going to be really important that you can be very clear with your membership about what they can expect about this return to in-person church gatherings. So you want to make sure that you properly address seating, properly address the wearing of PPE, perhaps masks, perhaps also gloves. You want to make sure that there's clear designation within the building of where people can be, maybe where people line up to enter the building. You want to be very clear about how many people can come to any given service. You are probably not going to be passing things out, which is what we are kind of accustomed to. So whether that means, passing out bulletins or passing around the communion or passing around the offering plate, that's going to be ill-advised at this early stage. So you want to make sure that you paint a clear picture for your congregation, for your membership. You want to make sure you're clear about how many people can arrive, and you want to be able to communicate the protocols in a clear way in advance of them arriving to the building, in addition to being able to have good signage, good indicators on the floor, etc., about where people can be at any given time. So I want to next talk about the distinction about how you might address these legal considerations based on the type of facility the church has. If your church owns its facility, then obviously you have a greater level of control around what happens on the premises. You have a greater level of control on deciding when to open. You have a greater level of control over what happens in terms of who comes in, etc. If you rent your facility, there may be certain restrictions that the landlord would impose because, again, the landlord is wanting to mitigate their risk as well. Now, if you're a mobile or pop-up site, so for example, if your church had previously been meeting at a school or a theater or a hall, American Legion post or something of that sort, you may have fewer options of where to meet because many of those places may remain closed for quite some time. So you might find yourself having to review your contract, your legal commitment. Does it allow you to cancel your current space and maybe find another space. So these important legal considerations must be evaluated. Now, I want to move to inviting Scott Graham to this conversation. As you've heard, he is the Director of Emergency Preparedness at Holy Cross Health and also the Vice President of the Maryland Region 5 Emergency Preparedness Coalition. His everyday involves dealing with emergencies and medical considerations such as what we're experiencing right now. So, Scott, thanks for joining me today.
Good morning. Thanks for having me, Erika.
So, Scott, why don't you share with us, if you will, a little bit about what you're seeing on the ground in this COVID-19 era?
Well, it's definitely a build design model versus designed and then we built it. Many of the things that we have prepared for have led up to our success in the COVID-19, but there are also things that no one working in today's generation of emergency preparedness, hospital preparedness, or even those who are providers have ever seen anything like this. I mean, the last pandemic was in 1918, and certainly while there are many things that we have drawn comparison to, there's so many things that are new, and we have to make decisions on the fly. And we're writing a playbook in some cases as we go. The healthcare world, not unlike any other business, has a primary focus of safety and the protection of those for whom we have charge. And that's in healthcare, that's our patients and our providers. We decided early on, along with the governor, to eliminate one of the other charges that we would have, and that would be the safety of our visitors and community that would come into our facilities. So I think that was a very wise decision to, while difficult, to eliminate the visitors to our facilities, only to help limit and minimize the spread of COVID-19. So it's truly new in so many ways, but the foundation and the premise to how we approach preparedness, whether it be a hospital, whether it be a church, whether it be the fire department, a community, whatever, the premise and the foundation of that is still all the same. You have a good plan, and that plan has to be firmly cast in jello. You have to be flexible. You can't think of every situation. So at the ground level, at the provider level, there are a lot of moving parts, and the basis of incident management is to have a strong and solid team who are cohesive, that understand that this is a process, it's not a project, and they all work together toward the goals that you establish as a team.
So Scott, that's really good. You mentioned having a plan. So how important is it to have a written plan and supporting documentation for that plan?
Well, the plan, it's your guiding document. You have to have a plan. And it doesn't have to be perfect, but it has to outline some of the priorities that you have as an organization, whether you're a church or whether you're a hospital. And as I mentioned earlier, whether you're a municipal government, you have to identify what your priorities are in the event of a man-made or a natural disaster. And in that plan, it goes through the entire life cycle. So we've been engaged. I brought our incident management team together around the, I want to say the 9th or 10th of February, just a small group to start talking about Wuhan virus at the time, which is what we knew it as, whenever it was reaching the shores in the Seattle, Washington area. And over the next couple of days through Ash Wednesday, the conversations became more intense. And we decided at that point that we should put together an informal, or what we called a modified incident management system. That's where we got the plan off of the shelf. And we said, okay, what we had written what we have developed as a healthcare system. How do we implement this, and what are our priorities from that plan? In something like a pandemic, and even something like a hurricane or a flood or a fire, you're not going to be able to write or predict or prognosticate step 1, 2, 3, 4, 5. It just doesn't happen that way. But if you identify the main premise of what your priorities are, life safety, continuity of operations, restoration of business, and the things that fall in between it, that's what you want to see in your plan. There are people who will write plans that are so complex. And I've responded to many natural and man-made disasters in my career. And some of these plans, while well written, the volumes of binders, they worked very well holding the doors open, because when we lost power, it got hot in the room. You know, nobody was reaching for these giant binders trying to find the information they needed. So the plan has to be extremely simple. It has to be very easy to communicate to your staff and to your volunteers, people who are not, you know, financially affiliated with you, but they are relationally affiliated with you. They have to be able to understand it. So the plans are very, very important. And to be honest with you, in this pandemic, it is not too late to bring your team together safely and put together your plan going forward, your restoration plan, your continuity of business plan, how you bring things back together. If you didn't plan before now, it's not too late to get into the game, because in the new season of opening, it's a great opportunity to identify what you didn't know, didn't discuss, didn't document, but it's also an opportunity to put together going forward.
That's really good, Scott. I love that mantra that it's not too late to plan. I think that's an important message for folks to hear. So when we talk about the plan, can I get into some particulars I'd love to hear your thoughts on?
Sure.
So of course the plan is going to vary by jurisdiction, by the size of congregation. Churches that have a strong online capability might be willing to sort of weather this for a longer time perhaps than churches that don't have such a plan or such a capability. But what are your thoughts around managing seating, about social distancing within the, can you give us your thoughts there?
If you bring to and look at the footprint or the layout of your structure, your physical footprint, and let's say your congregation, whether it holds 100 or whether it holds 1,000, you start to look at the social distancing recommendations that have been placed out by CDC and some of our health. And while it's not going to be traditional, while it's not like it was the Sunday before Ash Wednesday, it's going to be different. And that's where I spoke earlier about managing expectations. You have to communicate to your congregation prior to reopening, hey, this is what we're going to look like. It's going to look a little different, might be kind of awkward, and it might not be your favorite seat in the fourth pew to the left and the second seat over. You know, folks that sit in that same seat every week, and you know where they're going to be. But look at your seating. And perhaps a suggestion is using every other row and then every fifth seat to start out for. Let's call this their phase 1 of repatriation. So a wife who've been together in their home, like, would really love to sit next to each other together. For this time period, they may sit in seats 1 and seats 5. And then, continue down with that social distancing. And then in the next phase, you open up seat 3. So then you would have people sitting in seat 1, 3, 5, 7, 9, and so forth. And still every other row. What you work with your staff, and we go back to that plan, the staff and volunteers that are seating people and greeting people into your church, pre-communicate that you're going to come in. We don't want people congregating in the vestibule or in the lobby area. You will be directed by one of our staff to your seat. And it's almost like a wedding. We're going to bring you in. And even though you may not want to sit in the front row, don't be the first one there, because you're going to be placed. We're going to fill it up as they come. And then the same thing with in-service. We want to, I won't even say minimize, we need to eliminate the physical contact of people in our greetings, etc. For the short season. You know, this is going to change. We will get back to a new normal. And then when you're leaving the service, your volunteers, your ushers, your greeters will discharge you or will dismiss you. We'll start at the last row and we'll dismiss that row. People need to maintain social distancing. They won't congregate again. Please just leave, go directly to your cars. For those churches who have satellite parking, etc., because you're going to be seating less people, you won't be using your shuttles. Your shuttles are like rolling incubators right now for anybody who may be positive or suspected positive. So everybody will be parking on site. Just go directly back out to your cars. Let our ushers and greeters dismiss you and be very organized with that dismissal.
That's good. That's really good. And what about mask and other PPE that may be required? Would you consider it required, recommended? What about churches? Would they have the ability or desire, you know, masks for their attendees? You know, I imagine myself in worship. You and I have had the blessing of, you know, even being on the worship team together, and I can't imagine, you know, singing with a mask on, but that might be what we have to do. So what are your thoughts around that?
Yeah, no, I agree. And worshiping with a mask on is probably a little muffled. However, I highly recommend, and so do our government leaders and our healthcare leaders, recommend through this time frame masking when you're in public. And just because you're inside the building doesn't mean you're not in public. So I definitely would continue with the masking, and I would also have masks at your entry points. If you have the capability to do infrared temperatures as people come through, the non-touch temperatures, there are hospital facilities, there's government buildings, any place you go in right now, you're going to be screened for your temperature. And again, front loading this information to your membership. When you come through the door, you'll need to have a mask. If somebody comes through and they forgot their mask on the kitchen counter, you should have a box of masks there to be able to give that person one. The other thing is using the infrared thermometers, not to actually touch a forehead, but they have thermometers that are available that you would scan near the forehead. And if somebody comes through your doors with a temperature greater than 99, while they may seem symptomatic, they may be asymptomatically positive. And you want them to, but again, your church would hate to be ground zero for a resurgence, contact tracing of a lot of cases. So even having one of your volunteers there scanning temperature, I never want to compare my church to a business, but if you talk about business, churches can all contract parishioners and lose the confidence.
Firmly agree with that. So and exercise the plan with all their staff and volunteers. Specifically, want folks to.
Three things are unity of effort and managing. What is your plan? And again, it doesn't have to be, you know, War and Peace. It doesn't have to be volume after volume. But what is your plan for this week? We would like to safely bring our parishioners back. We're going to exercise social distance, our congregation as such, to promote that social distance. Simple premise of those plans. And just because, you know, they'd really like to sit here versus there, stick to that plan, because, you know, there's a term that we use, and managing expectations is just a crazy way of saying ahead of time. World going to many hurricanes, we always used to say the managing expectations, that's putting up the plywood. Leaders, we want to be a part of that. So that managing expectations piece is painting the picture for folks who don't look for exception when they get there. And lastly, if I have a second, don't exclude a different conversation for us to have it another time. But I've been working closely with several to be able to file for some of the nonprofit grants and some of the assistance grants, not just for their church, but those grants that will provide them money to purchase food for to give away to those in need in their communities. So that's a conversation I'd love to have with you, but churches, start to look for those. Go fishing for those grants and what would be applicable for your particular church.
No, that's big, Scott. I'm grateful to have had the opportunity to assist a number of churches to the tune of, many millions of dollars through the PPP loan and other government grants, and it really is critical to take advantage of those opportunities so that the people that we serve, right, that churches serve can benefit from us reaching out to receive these grants that are available. So I echo that. Well, as we look to wrap up, I just want to make it clear, we're touching the tips of the iceberg here. We can't possibly unveil all the concepts around returning to in-person gatherings or dealing with many of the COVID era, as I call it, issues. So, we do want to make it clear that this isn't meant to be a deep dive, and we will continue to share more information over the coming weeks. As we wrap up, Scott, I just wanted to get your thoughts on maybe some of the other operations, like if your church has a cafe or a bookstore, or there are churches with credit unions, etc. And the big one, children's ministry. Any thoughts around those things?
Well, certainly for the children's ministries, the schools and things like that, you're going to be following your jurisdictional guidelines. If there are opportunities, like cafes and bookstores and stuff, right now, offer online bookstores, offer the opportunity for them to either reach out, via email or even phone call and say they'd like to purchase, etc., and you can send those things to them. Cafes are pretty much off the books right now because that's a gathering, and we all do it. We're humans. We're inherent to get a little closer in line and see somebody we know, etc. The children's ministries, again, there are so many online resources that we can use. But other than that, I would say that we would pretty much write those off for this phase of it, and just try to bring those back as part of your business continuity plan at a later date.
Yeah. Well, I just want to echo that a proper, well-vetted, reasonably documented plan goes to that whole reasonableness standard. I presume that that's a standard that we should consider right now. Again, of course, it's early, and all the litigation that will inevitably come has obviously not matriculated through the courts, many of which remain closed to the public in any event. So, but generally the law wants to see that we've acted reasonably. And so as things continue to unfold in this unprecedented time, we will continue to keep you up to date. If you have any questions, please feel free to reach out. My contact information is there, and Scott, hopefully we'll have a chance to talk again to be able to share important information in this complex time. Any closing thoughts on your part, Scott?
No, I just think this is an excellent opportunity that you've provided churches to really take a look at their business. I would strongly advise them to reach back to you and work on a business continuity plan, because we have to remain whole, and we have to remain present for our ministries. And I think that the planning that you've assisted us with in Region 5, for example, has allowed us to prepare for the situation that we're currently in and how we recover from that. So I appreciate your help, and certainly I wish everyone blessing and luck in this season. Really, it takes some work, but it's not overcomable. And I keep referring to it as a season. The season will change, and we look forward to seeing what that new season is.
Thank you so much, and thanks for everyone who attended today, and we pray that you all will stay well.